It was 2 weeks before graduation. I was going for a ground ball. Another player was going for a ground ball. Right when it happened, like the whole world went really bright.
The ref blew the whistle and I looked back and Tommy was laying down with his head down. I thought he was going to be fine. I thought it was like a stinger or something.
You know, a pretty mellow hit compared to other hits that I've seen.
When I initially came to him, he was on his knees, bracing his head. You know, my initial instinct is, okay, you know, he has a head injury. You know, I asked him if he had any neck pain and he said no. So I start to go through concussion testing. So I'm asking him, you know, memory questions, recall questions. I'm checking sensation, like on his face. And that's when he tells me that he can't feel the back of his head. That's a sign of some kind of nerve involvement. And I told Coach Colt, I think we should call the ambulance. And so then a parent came up and he's like, oh, I'm a doctor, you know, can I help you? And I always love a second opinion.
We're trained in medicine to be especially concerned about neck injuries if there's a collision that occurs with the neck flexed. He told me that he was hit from the side, and grossly, neurologically, he was intact. He was moving his toes and his fingers. I was thinking that the likelihood of any kind of serious injury, in particular a neck injury, is pretty low.
It's always in the back of your mind. Calling 911 is this kid in 2 seconds going to be like, you know what, I feel fine.
So from this video we can see a pretty typical mechanism of injury, which is a compressive force applied to the top of the head. It's more dangerous if the head is flexed because this affects the more superior vertebrae. In this video he actually did fracture C1, but because his AT knew the proper C-spine techniques, spine boarding techniques, and things to look for to evaluate spinal cord injuries, she prevented him from being paralyzed or even dead. So signs and symptoms of spinal cord injuries include sensory impairment, voluntary motor paralysis, spasticity, impaired respiration, the inability to control body temperature, heart rate may increase or decrease, respiratory rate will be rapid but shallow, blood pressure could decrease, and the loss of bowel and bladder control all are common signs and symptoms of spinal cord injuries. For the immediate assessment and evaluation, first you're going to determine the scene safety, make sure it's okay for you to go out there, then check level of consciousness and ABCs. This can be difficult because of the helmet. It's not as easy to remove the face mask like a football helmet, which is a big dispute whether you should just remove the whole helmet or not, if it's worth it to get the airway or if it's too risky to move their neck. But if they're conscious, you can go ahead and ask about extremity numbness, find out if they have any abnormal pain or paresthesia, if they have any muscle weakness, see if they can wiggle their toes or their fingers, and then ask about neck pain with palpation or just in general. And then if there's suspected head trauma, obviously go into concussion evaluations.
Lacrosse and football equipment vary in different types of ways. However, they're similar in the fact that both the helmet and the shoulder pads have different styles. For lacrosse, there is research that says that the helmet can be left on versus taken off while maintaining the shoulder pads, just because the shoulder pads are a lot thinner and smaller and they cause a minimal elevation of the thorax. However, the lacrosse face mask is harder to remove versus a football face mask. Some lax helmet models actually have small brims that don't allow the face mask to be tilted up after cutting the side clips. Others have clips on the brim or hidden clips that ultimately still make the removal of the face mask that much harder. This sparks controversy as far as to leave the entire helmet on or to try and take the entire helmet off. And of course, with other helmet regulations, a lacrosse helmet does need to meet NOC standards. The all-in-one principle is just as it seems, whether or not you need to take off all equipment or none of the equipment. Research has suggested, as we know in football, that helmet and shoulder pads must both come off if any type of removal of equipment is needed. However, lacrosse is different because of the makeup of the pads as well as the controversy of the helmets that we explained previously. So, research has been limited as far as lacrosse being able to accept this all or none principle. A lot of the research that we have found has said that there's more research that needs to be done as far as keeping the helmet on or removing it because of the difficulty of the face mask. So with this C-spine motion study, the researchers found 3 different conditions as far as helmet fitting: a helmet that is fitted properly, an improperly fitted helmet, and no helmet at all. These 3 tests were determined the proper fit of the helmet. The researchers pushed down on the helmet to see if the pressure felt evenly amongst the athlete. They moved the helmet around to make sure the skin moved with the helmet, as well as they asked the athlete if it felt firm but comfortable. In this study, they tested all 3 planes of motion to see if there was any difference as far as the fit of the helmet, as well as no helmet at all when holding C-spine. They found that a proper and improper helmet fitting had greater range of motions than if there was no helmet at all. However, in the sagittal plane, it was greater in the improper fitted helmet versus a proper fitted helmet. So, meaning there was more movement altogether in an improperly fitted helmet versus a properly fitted helmet. But this research ultimately said that the C-spine motion was minimized most with no helmet conditions, indicating lax players' helmets may need to be removed for stabilization.
In conclusion, it's very important to know the signs and symptoms and mechanisms to look for when looking for spinal cord injuries. In lacrosse, the research still isn't quite there yet, and it needs to be further researched, especially when it comes to the equipment and how it affects the C-spine and stabilization. And more information is needed to help ATs further protect these athletes.